So I'm going to start talking through and introducing the webinar today. First off, I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional owners on the land in which I am currently sitting, and pay my respects to elders both past and present. So I'm Marley Bauer, a postdoc at the Municipal Centre for Research in Mental Health and Substance Use at the University of Sydney. And today I'm really happy to welcome you for what will be a really exciting webinar and the second in a series in a collaboration between the Matilda Centre and the Henry Halloran Trust, looking at the relationship between the built environment and mental health. And I think that the COVID lockdown over the last few months has made this relationship particularly clear. There's really nothing like being contained in one place or in one local area or even one neighbourhood for weeks or months on end to realise how detrimental certain aspects of your immediate environment can be on your mental health. So this interest began through a workshop between academics and practitioners in psychology, mental health, physical health, urban planning and architecture, where in our own experiences of work, we had noticed the relationship between the built environment and mental health, but there was not so much of a common language to link these areas. So for example, in my own research, I've looked at the experience of loneliness amongst people who are homeless or exiting homelessness, and the inequity in the type and quality of spaces that are often allotted to people exiting homelessness in our society, which often don't take into account the personal needs and desires of these people. So we formed a network to look at these issues in a kind of interdisciplinary and collaborative way. The aim of this network is to bring together researchers, policymakers and practitioners currently working independently across silos together to share skills, expertise and develop frameworks. We want to promote the role of mental health in the built environment research and practice space, but also the built environment in mental health research and practice settings and space. And we want to build capacity to translate research evidence into public health and planning policy and practice through inbuilt partnerships with practitioners in the field. So if you as a practitioner, a researcher or a policymaker are interested in joining the network or being on a list to hear about any further events or publications, please register via the link that we'll send you tomorrow in a follow-up email. But also please feel free to share any comments about things that you'd like to see in the future, as we'd love to hear from you. So now to our presenters. The first up is Associate Professor Xiaoqi Feng. I first met Xiaoqi when we were both working at the Centre for Health Research at Western Sydney Uni when I was just starting my PhD. But since then, she's been pioneering really interesting stuff in this space, and I'm really excited to have her speak here today. So Xiaoqi is an NHMRC Career Development Fellow at the UNSW School of Population Health and an adjunct professor with the National Institute of Environmental Health at China CDC. Xiaoqi leads a program of research focused on enhancing population well-being through identifying modifiable environmental factors like disadvantage, urban green space, or food environment that shape health and developmental trajectories and inequities amongst newborns, children, adolescents, and women across the life course. She's authored over 140 publications and led major research projects, including over $9 million in funding, such as through NHMRC or the Heart Foundation, and successfully translated her research into policy and practice. So today, Xiaoqi's talk will summarise a recent reconceptualisation of the domain pathways that link urban green space and mental health, to which she contributed as a member of an international team, including Ludwig Maximillian University Munich, ISGLOBAL, I think that's how you say it, University of British Columbia and Uppsala University. She will then outline some of her key findings and studies of green space quantity, quality and type using Australian data. So the plan today is to have Xiaoqi to speak for about 15 minutes or so, and then I'll introduce our second guest, Dr. Emily Rugel. But there's also a Q&A box at the bottom of the screen you should be able to see where you can record questions as they come up during Xiaoqi's talk. So just type your questions in there and I'll read them out at the end during question time. So now over to you, Xiaoqi. Oh, you're on mute.
Yep, I'm just trying to find the button. Thank you very much, Marley, and also Matilda Center inviting me and introducing me. And today I'm going to spend about 15 minutes there to introduce about my green space and mental health research, and looking forward to our discussion. So today we're going to have 3 parts, which I will shortly, briefly, just introduce myself a little bit. As Mali mentioned, I'm a social professor in the School of Population Health at UNSW. This is a new name. We just have this new name, I think, a couple of weeks ago. I'm really interested in using big data to investigate the relationship between population, health, well-being, and environment. I have done quite a lot of research on green space and health. Probably in the last years, I published over 40 papers about green space and health in general. These are just some papers I published. Most of them are open access. So if you're interested, please feel free. Just Google look in my Google Scholar. You should be able to download them if you want to see a bit more in detail. My research achievement in green space and health not only recognized in academia, but also with industry as well. So those are photos that was taken last year in the Austria Park and Leisure Industry Award event, which I got the National Research Award. I also would like to congratulate to this year's award winner is the NSW Sports. Well done. And as many of you, I also actively working with policymakers and local health districts. This is one of the events I attended and also presented at the Western Sydney Diabetes Alliance, where I am a committee member for about 8 years, actively trying to make our environment healthier and also greener, particularly in Western Sydney. So now let us talk about green space and the mental health. Well, in the last few months during the pandemic, I don't know whether you have noticed that you have visited your local park a little bit more often than usual. I certainly do. Most of the mornings, I walk to our local park and just have a little bit physical activity, walking my dogs. Some of the afternoons, I'm just going to sit there and looking, children play around in the park. It let me feel better. In the morning, I feel energetic, but also I felt that although I'm kind of isolated because of lockdown for a while, but also I still kind of connected with people in my neighborhood. So, good news is that NSW government are investing money, 290 million on more green space and open space, which I think is very important. I think just a couple of months ago, Victoria government also announced that they are investing $150 million to upgrade their parks and also develop some new parks in their neighborhood, because they realize and they can see that people really love to use their local parks. And also, there are two primary priorities in our state. They're going to have more green space in our neighborhood and also more tree canopies. And I think this is great news. And I think this is also very important. This is the earlier paper we published about 6-7 years ago with colleagues in Melbourne, which we hope that, after all these amazing policies that from NSW and also Victoria government, that the map you say here, at least for Sydney and Melbourne, could be greener. So what this map tells us, we look about the green space access within 20 minutes walk, 1.6 meters that in your neighborhood. What we find is that a lot of people actually doesn't have any access to any kind of public green space, and all have very little, which you can say is either white color on the map or very light color of green, which means they have either no or very little green space to access. And then when you look at about the household income, how this is associated with the green space access, and it seems that people who have lower income, they tend to have the least green space access. Well, you may say, so what, right? Just have less green space access. Well, we think that probably green space is really important for our health. A group of researchers from all over the world meet up 3 years ago that doing research in green space, environment, and health. And if you are in the environmental epidemiology, you probably know some of them. So we developed a pathway and looking about the linkage between green space and health. So today I'm going to adapt this pathway to talk about the linkage between green space and the mental health. So the three major pathways are restoring capacities, building capacities, and also reducing the harms. So when we talk about restoring capacities, you probably have those experiences when you walk to a park after a long day, hard work, and you feel much more relaxed, listen the bird song, get the fresh air, and you feel relaxed. This is good for our mental health, we know. And some of us, when we go to the park, we do physical activity, which better physical health is good for our mental health. Or you go in there with your friends and develop your social capitals, which have a nice chat, is also good for our mental health. And to some of us, we live in some of the neighborhood, maybe with unwanted air pollution or heat or noise. The tree potentially will reducing the harm from those unwanted pollution, which will good for our mental health. Imagine you have a little bit quiet night, which will help you potentially have a better mental health. So I'm going to use some examples and to show you that the linkage between the green space and the mental health. Well, first you probably wondered whether more green space means better mental health. Well, my team and I used the longitudinal study of Australian children, which is a national representative data, looking about whether children living with a lot of green space is good for their mental health. Well, from our research, what we have seen is that the answer is yes. Children who live with more green space is good for their mental health, particularly is with 20 to 40% of green space, which you look at this graph, the bottom line here, which is consistently, and when children, regardless what age range they are, and it's always good for their mental health. So quantity of the green space matters. This is going back, to the policy, which is really great to say that government is investing in more green space. But is that enough? Just have a lot of green space. Does type of greens matters? Well, let's just have a look. So here we use the 45 study. Some of you might heard about it or even used it. It's a study with a baseline of around 260,000 people who live in an established state, age 45 and over. Roughly 1 of 10 people in this age range actually in this data as a baseline. So here's what we're saying, that people, if you look at this graph with this orange triangle, where it tells us that people who exposure to more green space and the tree canopies, they have a low risk of developing psychological distress. But we didn't find quite such effect for grass or other green. So which other greens means like the bushes, brush, so those other greens. And it may tell us that we really should protect and increase the tree canopies in our cities to enable that people benefit from the tree canopies and green space, particularly on their mental health. This is why I think this initiative that is so important by NSW government. We're going to have 5 more million trees in Greater Sydney by 2030. So I hope that we all can contribute to that. So now we talk about, the examples that from my research, but also I want to mention, I know Emily and her colleagues in Canada also look at about the quality of the green space and the health as well. So looking forward to hear more later. But I think, when I look at about this pathway, over time, I feel there's maybe something we're missing. Well, how about sleep? We all know sleep is so important to us, right? If you have less sleep for a particular day, we get up in the morning, well, it's quite difficult, but also it could be feel like exhausted and even a bit grumpy. And if you have done this for a long time, lack of sleep, it could actually develop some very serious physical health issue. Well, so where's sleep? place in this pathway? Well, here's what I think the sleep potentially will place on this pathway. Well, when we go into a park and exposure to the green space, we're going to feel relaxed, as earlier said. Well, that's help us to have a good sleep, and it's good for our mental health. When we go into the park, do a long running or play football, and we feel exhausted, and that's also help us to have a better sleep. And also, if it can reduce unwanted noise or air pollution, and especially in the next 3 months, some of the cities in Australia, most of the cities, I think, going to have the heat waves. And if some of the area, the green space could reduce some of the heat, and we're going to have a cooler night, and we're going to potentially have a better sleep, which will be good for our mental health. Well, so we should test that. We used the 45 study earlier mentioned, look at people at the mid-age and senior age, and look at the 3 major cities in our state, Newcastle, Sydney, and Wollongong. We find that people who are living in a neighborhood with 30% or more tree canopies, they tend to have 20% of lower hours of insufficient sleep. So when we talk about insufficient sleep, we really talk about it's less than 6 hours per night, defined by WHO guidelines. So fantastic. We need a lot of green space, at least a reasonable amount of green space, but also we need to have the right type of green space, which could maximum take the benefits from it. So is that enough? That's all we need to know about the green space. Well, let us say. Well, because I think there's something we should look at about is the quality of green space. So we also did some research on that too. So first, we look at children. We used the longitudinal study of Australian children. What we find is that green space quality really matters for our children's mental health. Not only matters, but also we find over time, the children who always exposure to high quality green space, their mental health is much better than their peers who exposure to low quality of green space when they grow. As you can see from this graph, this mental health well-being gap widen over time when they become older. So I think really important, we not just have a lot of green space, but we also need to think about the quality. This also applies to young moms. We look at about the moms who give birth, and we find that 26% lower hours of psychological distress among women with good quality green space nearby. I think this is fantastic news, that if we could provide in our neighborhood with high quality green space, it can reduce the mental distress for young moms. So now we learned quantity matter, quality matter, and also type of green space matter. And this is what I think is fantastic, that the primary priorities, really their policies match with our research results. And I'm hoping that we can see more tree canopies and also more parks in our neighborhood in the very near future. Well, when we talk about the quality of green space, I don't know what you're thinking at the moment, but I do believe quality means different things to people. So for example, I have a little sausage dog, so I love to walk my dog. So a park, if it's off leash or at least allow the dogs to running around on the leash, I think that's one of the important quality to me. But maybe to others, this part of quality doesn't matter. To the same park, maybe to the teenagers to play basketball have a place that is fantastic. But exactly the same park for the same reason that maybe to young moms would feel, I don't want to go to that park. It's a low quality to me because I worried those basketball will drop on my baby's head. So what does quality mean? And how we can make sure people all have good access and to high quality parks. So this is a newly funded project by UKRI and also Australian National Health and Medical Research Council. And I'm going to lead this project with Professor Maximillian from University of Glasgow Medical Research Council, working with colleagues from UNSW, University of Wollongong, Glasgow Uni, the Queensland University, and the CASO in the next 3 years to investigate this a little bit more. What kind of quality we need for our parks to enable, prevent mental health, and also help us have a better and stronger heart. Thank you. And to the students, if you're interested more about green space or in general environmental health, you can consider to join this master class that I coordinate in my school. And also, I want to use this opportunity, give a broadcast and promote for a forthcoming event in 2 weeks called Rapid Urbanization and the Population Health Research Network webinar, the ROOF webinar. So this is a research network in UNSW. I'm leading and with senior researchers on board, provide this platform for our earlier and mid-career researchers with senior researchers mentorship, develop research in this area. So for this particular event on the 24th of September, we're going to have the CEO of the Sydney, Monica Barra. She's going to talk to us a bit more about the urban regeneration and the COVID-19 related adaptation in Sydney. And also then followed by 5 earlier career researchers talk from UNSW. So please feel free to join us, and you can just search Rapid Urbanization in the Eventbrite and register it. Thank you very much. I'm looking forward to our discussion.
Well, thank you very much, Xiaoqi. That was really awesome. So now I'm going to introduce Emily. So Emily received her doctorate from the University of British Columbia's School of Population and Public Health, where she developed a regional model of natural spaces and applied it to prescription and health survey data. As a postdoctoral research fellow at Simon Fraser University and a visiting researcher at the University of Sydney, her work explores health-promoting community design with the aim of developing evidence that can be embedded in sustainability plans and in policies that advance equity. In addition to a PhD, she holds a Master of Public Health from Portland State University and a BA in journalism from NYU. But she firmly believes in the acquisition of knowledge through chance encounters as well as through scientific investigation, which I think we can all firmly agree with. So today, Emily's talk will be on identifying and designing environments that support physical distancing and stave off social isolation in the era of COVID-19. So over to you, Emily.
Great, thanks so much, Marley. I'm really excited to share this time with Xiaoqi, in part because our work is very complementary. But today I'm actually going to be focusing mostly not on my own research and really on the times that we live in. Again, I'd just like to acknowledge that here in Sydney, I'm on the lands of the Gadigal people of the Eora Nation, and I really want to recognize their continuing connection to land, water, and community, as well as paying respect to their elders, past, present, and emerging. Just to give you a little overview of what I'll be talking about, I'm going to focus specifically on one of those pathways that Xiaoqi mentioned, part of the restorative pathway, particularly social ties. Talk about how that use of different forms of nature for social connections has been impacted by the need for physical distancing as a tool to fight COVID-19, and really zone in on one particularly vulnerable population of children and youth. Then step back and talk more broadly about how our relationship with nature may be impacted both by the kind of long history of what urban designs look like and by our current times. And then finally talk about some of the ways that cities are responding to this crisis by developing programs that I hope will have a long-lasting impact on sustainability moving forward. So first, I just want to give a little bit more detail on that one pathway that Xiaoqi introduced, and that's specifically the way that social ties may really operate in giving us both physical and psychological benefits, but particularly psychological benefits from the nature that we're immersed in. And I think that this pathway is the one that I was really interested in when I first came to this work. And that's in part due to the fact that it's received a little less attention than some of the others, particularly that pathway via physical activity, which is where a lot of the research started. I think we may all know the ways in normal times that nature can help connect us, but there is a fairly large body of evidence. Some of the most interesting work, I think, began with Frances Kuo's efforts. She took advantage of a natural experiment in public housing, social supportive housing projects in Chicago, where people's residential environments were very similar, except some of them had more access to green space. And what she found was that across the lifespan, so for both children and their parents, that having more access to green space was really important in terms of forming those community ties with their neighbors. We've also looked then at how those community ties might be beneficial for our psychological health. And there's actually a huge body of research. If you've been to some of these presentations before, I'm sure you've been introduced to it, showing links to longer lifespans, to improved cardiovascular health, and of course, really importantly, to our mental health. As part of my PhD research, I looked specifically at different forms of neighborhood nature. So that's nature within 500 meters of people's homes, to see if in a large population survey in Canada, the Canadian Community Health Survey of Mental Health, if we could see benefits of that form of nature for some of the measures that Xiaoqi uses: psychological distress, negative mental health, and also major depressive disorder. And what we found is we didn't actually see these direct effects, but we did find that each 1% increase in both green space, so that's things like parks, street trees, vegetation that Xiaoqi was mentioning, but also natural space more broadly, to include rivers, oceans, and lakes. So just small shifts in the amount that people had in their surroundings were linked to much higher odds of reporting a strong sense of community belonging. So really feeling that you're part of your neighborhood community. And that in turn was related to significant reductions in all three of the measures we looked at, but particularly in the odds of negative mental health, with people who reported the strongest neighborhood social cohesion or sense of community belonging being 91% likely to report negative mental health. Now, this study looked at adults, but we've also seen similar benefits among young children. And a 2017 study that was also population-based in Scotland looked particularly at 5-year-olds. And they found again that having this higher access to green space was increased with benefits in terms of their pro-social behavior. So how likely they are to share, to be volunteer, to help others, which are really important, both of course for how the classrooms run, but also for their long-term psychological development. Now, I think when we, many of us were first introduced to the term back at the beginning of the pandemic, people used social distancing, but there's been a very intentional shift to physical distancing. And that's because even though in these times we need to maintain physical distance in order to reduce the odds of SARS-CoV-2 transmission, that's the virus that causes COVID-19, we actually need to maintain or even strengthen our social ties to deal with the additional stresses of this time. And that physical distancing is really critical right now because we're still working on vaccines. They're very limited effective treatments. And so these measures, along with things like hand washing and wearing face coverings, are some of the few that we have. Here in Australia, the recommendation is that we keep at least 1.5 meters apart, or about one adult kangaroo apart, if you need a visual. And that's not necessarily based on evidence, but there have been studies conducted by an advisory group within the UK and also by the World Health Organization that have shown huge reductions in risk when people are 2 meters versus 1 meter apart. So the group in the UK found a 2 to 10 times reduction in the risk of transmission, and the WHO reported a figure right in the middle, around 6 times. But unfortunately, our current urban designs don't necessarily allow us to maintain adequate physical distancing. So the footpath standard in Australia is only 1.2 meters wide. The City of Sydney does recommend that footpaths are at least 2 meters wide to allow 2 groups of people or an individual who's walking and someone in a wheelchair to use that space comfortably. But once we have larger groups of people, we're really unable to meet that need for physical distancing. And so I think one of the really interesting things as a researcher is how much research has come out recently in response to COVID-19. And this study came out just at the end of July and really wanted to say, what can we understand about the ways that different cities are responding to COVID-19? They looked at 20 cities across a number of different countries, ranging from low to high income, and they really typified this in one of three ways. So cities are focusing on restriction, investment, or education, although obviously many of them do a combination of some of the three. Locally, I think the clearest example we have of restriction would be in Melbourne right now, where really the regulations and guidelines that they're putting in place are very restrictive in terms of the time, duration, distance that people are allowed to spend outside of their homes. And that's really tied to a fairly strict enforcement mechanism. Another way that cities are responding is in terms of investment. And so that can be things like infrastructure. Sydney's pop-up cycleways is one example, or by kind of loosening some regulations. So one really good example of this is New York City's Open Restaurants program. So in New York to this day, people are unable to eat inside restaurants. And so the city really wanted to offer restaurateurs a chance to maintain their businesses by allowing them to take advantage of outdoor space. Again, where we know that people are able to be more physically distant. And they did that by both changing some of the rules for permits and also giving funding so people could build the necessary seating for visitors to their restaurants. And then finally, I think we're all pretty familiar with education. You've probably seen things either on social media, on Twitter, or actual billboards here talking about the importance of hand washing, wearing masks when you can't maintain that physical distance. And I think as the Melbourne situation really shows, some of the harshest impacts of these restrictions has unfortunately been on children and youth. So to this day, although things are changing probably in the next week or so, kids in Melbourne actually can't go out and meet, play with another kid outside of their house. In Barcelona, the restrictions were even harsher. There was a 6-week period from March to April where children weren't even allowed outside of their residences at all. And the reason that these restrictions are so important is because we know that outdoor play and play in natural environments are both very critical to the psychological and cognitive development of children, and young children in particular. Natural play spaces especially have been found to encourage more cooperative behavior. And if we look, there was a study of more than 10,000 parents that was just conducted by the University of Oxford to really see the impact of these restrictions. And they found, particularly among the youngest children, that lockdown, that social isolation, that lack of ability to access green space harmed all three of the outcomes that they investigated. Now, one solution to this might be to move as many things as possible outdoors. And outdoor education actually has a long and storied history. The kind of formalized instruction began with the forest schools movement in Scandinavia. That dates all the way back to the 1950s. And there's similar efforts in North America and here in Australia, where they're commonly called bush schools. But despite the fact that these types of educational environments have been around for quite some time, they're not generally that accessible. So they don't constitute a huge number of schools, and they can also be inaccessible because they often require a substantial tuition payment. Because not every kid can access these schools, but we know that outdoor environments are going to be critical in this time of COVID-19. Organizations like the American Academy of Pediatrics have really recommended that traditional schools move as much of their schooling outside as possible. And so because they can't transition to be outdoor schools in the amount of time that we have, and they've already been dealing with a lot of transitions, of course, their focus is really on conducting the highest risk activities outdoors. So those are things like meal times and snacks, physical activity, and then various forms of performing arts, singing and theater, where people are producing more respiratory droplets, which increases the risk of viral transmission. The other thing that schools looking to transition really need to focus on is infrastructure. So of course, for schools, they've been doing this for a long time. They kind of have things down pat. But for schools making a transition, they really need to think about where are kids going to sit? What are they going to write on? Do we need shade if it's in a sunny and warm environment? And what is the teacher going to write on, right? So there's no more whiteboard. How is she going to communicate to her class as a whole? And I think we've also realized that in order to move even a limited set of activities outdoors, that school districts really need to look beyond their existing spaces. So once again, New York has kind of been at the forefront of this, in part because in the US, they were one of the first cities to really confront the pandemic. They've started what's known as the Outdoor Learning Initiative, and within just 2 weeks of announcing the program, more than half of the city's 1,600 schools were approved to move some activities outdoors. And 40% of those are looking at spaces beyond the playground, so nearby parks or streets. And so I hope that I've convinced you that the reason that we are moving activities outdoors is because these outdoor environments are inherently less risky. But I think, unfortunately, the way that we're examining this issue has sometimes prevented us from really placing those risks. And there are still some risks, particularly if people are together in groups for longer periods of time, or if they're unable to maintain that physical distancing. But we really need to balance that against the benefits that not only students, but people across the life course can get via social interaction and physical activity. And here, I think, unfortunately, the media has not necessarily been a good partner to public health. I know when the lockdown and restrictions first happened in Sydney, there were all these pictures of Bondi Beach and how crowded it was. Bondi Beach was closed as a result, and people lost access to that blue space and green space. But some of that is just about the way we're framing the debate, whether that's literally through a camera. So here you see two pictures of the exact same moment in Copenhagen, one that might really give us some concerns about overcrowding, and the other where we can see people are maintaining adequate physical distancing. And unfortunately, in part because of that narrative and because we haven't necessarily taken the benefits into account, many cities have actually limited access to natural spaces during the pandemic. And this is really concerning because, as Xiaoqi mentioned in her study, we know that there were existing inequities in access to natural spaces around the globe before the pandemic started. So this is a very similar map looking at the region where I did my work in Vancouver, and you can see that there's just a huge range in the amount of publicly accessible green space that people across the region have. Unfortunately, as with Australia and North America, we see that these differences in green space access are often correlated with socioeconomic status, where people of lower SES have less access. They often also have less access to private green space, such as backyards, gardens, and patios. And these private green spaces, because they're the nearest nature to people, have actually become more important during COVID-19 because people's activity spaces have been so reduced by many of the guidelines and restrictions. And we know now that this may be true in Australia and in Vancouver, where I did my research. It's also been found to be true across the US. So the Trust for Public Land conducts a survey every year looking at whether people have access to a public green space within a 10-minute walk of their home. Pretty standard definition of green space access. And they found that more than a quarter of Americans don't. In the UK, this number is 2.7 million individuals who lack access to public green space. And so one really simple solution is just undoing those measures to close parks, and even opening up hours within the parks, so people can not necessarily be going there at the same time, and again, be able to maintain that really important physical distancing. I'm also going to talk about two really interesting other approaches to allowing people to have more access to outdoor environments during this time of COVID-19. The first one is kind of broadly known as open streets, and it really focuses on opening streets both within and around parks. New York City actually started their broader open streets program just within parks. So they're now up to 160 kilometers of these streets that are close to vehicular traffic, but open to pedestrians and cyclists. But it actually began just with 10K in and around parks. We've seen similar park closures to vehicular traffic in places like Minneapolis and Portland, all across the US. Again, coming from Vancouver, one of the efforts that I was most interested in took place in Stanley Park, which is really, it's kind of the Hyde Park and the Botanical Garden combined here in Sydney. So it's really the jewel of their park system. And in response to COVID-19, they closed off all of the surface streets to car traffic. But it's actually become a pretty contentious issue in the time since. So people were concerned that it might actually limit accessibility to individuals who needed to drive or needed to use wheelchairs and other assistive devices. And they were also a little concerned that closing off the parking lots would mean that the parks were missing out on a really important source of funding. So they've kind of come to a compromise now. The roads are shared by cyclists and vehicular traffic, allowing pedestrians to have space on the path. But this kind of open streets movement is really extending beyond parks now and looking at a whole range of other types of activities that can take place on streets once we give them back to people and claim some of that space back from cars. So I think one of the avenues that's really been adopted worldwide, including in Vilnius, Lithuania, where basically the whole city was transformed into an alfresco dining location, has been to transform streets to allow for outdoor dining. A lot of these efforts have really been quite ad hoc, however. So if you're interested in this, excuse me, I would highly recommend looking at this report from the National Association of City Transportation Officials, because they really approach it in a very formalized manner. Talk about how you need to take into account the existing design of the street network, where you are in the pandemic, and then they have all sorts of ideas for what we can do with these new spaces. Everything from cycling and walking and dining to even setting up public health emergency infrastructure. And here I think it's important to note that the benefits do extend beyond health, particularly to economic benefits for affected businesses. And so I think, as we all know, this pandemic has really changed us as individuals and as societies. And Xiaoqi mentioned research showing that people have become more connected to nature during this time. This is backed up by survey data from around the world. So a survey of more than 1,600 adults in Canada showed that 70% had found their appreciation for nature had grown in response to COVID-19. Another national survey conducted by the UK's National Trust found that people also found these experiences very helpful for their psychological health. So 68% of their respondents said that it made them feel happier. And my hope is really that these changes are long-lasting, and that we see this shift from cars to people and this renewed focus on the importance of both natural environments and urban designs more broadly to our mental health, so that there can be something good to come out of these very challenging times that we live in. And I am looking forward to our discussion as well. Thank you.
All right, so now for questions. We have a couple, but please feel free to post or think about them or prep them as they come. So the first is from Tanya Singh, who asks, do you also do some mediation analysis with air pollution and or noise together? I think this is for Xiaoqi. And do you look at SES in some other way other than controlling for it? And she notes this is important because people with lower SES live in less green areas. So I guess there's different methods other than controlling required. Thank you.
Awesome. Thank you, Marley. And also thanks to Emily's presentation, it was great. Okay, so Tanya, we are actually having some work that my PhD students are actually looking about the mediation analysis between green space and house outcome, but the mediation analysis including air pollution. But we haven't looked at the noise as a mediator yet. So you might be interested. And then the other question, I think you asked about the SES, and you're very right. And from my research, I guess from observation, that people, well, with lower income, they tend to living with a nice green space. And what we have done is controlling for it. And I think as epidemiologists, this really tell us something, because most of the research we have done is controlled for either neighborhood deprivation or the individual income or education. Because our research still shows after you control for all those important confounders, socioeconomic factors, the green space still played an important role on our health. In other words, it's saying it doesn't matter whether you live in a rich or poor neighborhood or your income, and if you can exposure to good amount of green space, high quality green space, the right type of green space, is good for your health. So we can't just say, oh, because that area is poor, let us everyone move to Mosman in Sydney, in which, the average housing price is about $3 million. But we can't move people in a rich neighborhood. But what we can do is provide them more tree and green space access, high quality green space. And this is what the government is doing, which I'm very pleased to say. So hopefully I answered your question, Tanya.
And I just want to chime in. So we actually conducted a systematic review looking at the interrelationships among all of those various spatially correlated urban exposures. So looking at noise and air pollution, green space. There's really limited evidence right now for studies that include all of those. We found only 3 out of the 54 studies that have looked at least 2 spatially correlated urban exposures and physical health that looked at all of them. The work that I presented on the social interactions, we did do a formal mediation analysis, and that's actually how we were able to uncover that there were those indirect benefits to mental health, even though we didn't see direct benefits. But I think this is really important in the field of environmental epidemiology in general, that people live in very complex environments. And I think sometimes when we have findings that run counter to our hypotheses, that's in part because we're not adjusting for the full complexity of those environments. And of course, people's individual and area level socioeconomic status is a really important component of that.
Okay, I think that was really interesting. So now on to the next question, which is kind of more of a statement. But it's from Leslie Rogan, who says, I'm part of a community in Western Sydney where we're about to lose a significant open space area. During the COVID lockdown, we're losing 4 trees, mature trees that are around 190 years old, which were removed within a kind of heritage project space. So I think they're concerned that, not to mention the rising population density increased by 75% in the preceding 20 years, as in addition to the connection with mental health proposed with moving out of parkland environments to high-rise situations within the Westmead Hospital precinct. So how do we adjust the advocacy of communities of benefits to site? Yeah, so I suppose it's more a comment, but I suppose, I don't know if either of you would like to talk about this kind of broad movement to more urbanization or rapid urbanization and the impact on mental health.
Yeah, so I'll just talk quickly. I think we definitely have evidence that shows that dense environments and a high-rise living can have psychological harms. And we also need to realize that when we have existing green space resources, but we're having more people that need to use them, that then means less space per capita. It's more likely to lead to crowds. I think it was really interesting that she honed in on the loss of those trees because Xiaoqi's research really shows how important trees are as a specific form of green space. And I think it's one of the limitations of the urban responses to COVID-19 is that successful tree planting programs like Sydney's 5 million trees effort actually do take a long time to come to literal fruition, right? So you're not planting large trees that are already providing shade and maybe providing a space where people want to come together. I think one thing we can do as researchers is by developing good maps of all of these different forms of natural space so people can see what exists in their communities and then advocate for more. But I think in the moment when you're losing parkland and 150-year-old trees, it can be really devastating to people psychologically. So I think that's where we in public health need to do a better job of explaining to the people who make those decisions, which is generally not people in public health, what impacts those decisions might have on population level psychological health.
Yeah, I agree with Emily. When those things happen, I can imagine not only we lost some very mature trees, as Leslie said, about 190 years. It takes 190 years to grow. But I guess there's also a lot of emotion, grow with that, especially if you're living nearby, and this could be a tree see you, how you grow up. And over time, I still remember there was a very nice romantic movie, probably all watched, called The Fleet, that little girl and that young girl trying to protect the trees that grow just in her neighborhood. And I think what's very important is that this is where I'm really passionate about, is working with the policymaker and the city planners, that when they think about planning the city, take into account about the health benefit, the health policies. And this is exactly what I hope that this roof rapid urbanization and the population health network, that we can working together to achieve. So I also know that, I don't know whether this applies to your case, Leslie, that in many cases I sometimes see some really amazing, mature tree that there will be a notice say we're going to remove it, but they normally will grow some new trees, and not only just one, normally there's several more and the similar or same species around the area, which is not a too bad thing, although I appreciate it will take years to grow. So hopefully we will have opportunity to working together to protect our trees and also increase the canopies and in our society.
So Leslie put in a few more comments that there was a focus on the fact that it was a National Heritage listed site, the Parramatta Female Factory, and the rebuild of psychiatric care within Cumberland Hospital into high-rise, which is a comparison to a single-storey parkland option. Another question that I was desperate to ask both of you is, what's the kind of ideal situation you can see coming? COVID seems like a little bit of a catalyst for change. In the best case scenario, what do you guys see as a really, I suppose, good or idealistic option of things changing to better improve people's mental health?
Well, I think this is a really great opportunity. For example, like the green space. And people probably now more than ever realize how lucky we are, and if we are living closer to green space from observation. I remember there's a lot of physical equipment in the local parks, but normally not really many people use it because the lockdown and also gym have the risk of having the COVID infection. So people actually use it very often now. And I think this is not only let us think about, okay, governments think about we need to have more green space, but also opportunity for us to promote for everyone to access, to use their park, to enjoy the benefits, because not everyone at the moment actively using their park, even is fairly close. And the other part is about what's in the park and also what's outside the park. Bring people to the park and also let them feel there's something they can do as individual, group, and also safe to use. So this is the project we are running at the moment, officially launched it from this month, to investigate further about the better parks, healthier for all. So hopefully we'll have more to talk later on. Yeah, thank you.
And I guess for me, I think there's two things I'm really excited about. So one is that kind of shift of a lot of urban space from car traffic to people. And a part of that, of course, is greening efforts. But I think there's also all of these other ways that we can promote social interaction and physical activity, and just make cities more pleasant places for people to live. But I think the other thing that COVID has really taught us is the importance of nearby nature. When people are restricted to these smaller areas around their homes. And I think that there are ways where we can densify and still offer green space to people. So things like green walls, green roofs, having our water infrastructure be natural instead of hardscaped. So there's lots of ways that we can have cities that are growing and densifying, but still meet the needs of all of their residents for nearby nature.
So we have 1 minute left on the clock. I was wondering if there's any final words or messages that you wanted to get out to the audience around this space, or any kind of pressing final comments. Emily?
Yeah, I guess I would just, you know, as I said, I'm really heartened by the fact that people have taken advantage of this time to get more connected to nature, to their local environments. And I really hope that people find that that's a sustainable behavior, and that in turn propels them to advocate for the types of designs that Xiaoqi is mentioning, ones that really take advantage of the power of green space to support our mental health.
Great. Thank you, Emily. And I also want to thank Marley and her colleagues and organizing, this networking, inviting us to have these great discussions. To me, I think this is a great opportunity that let us leave the screen and go into the nature and interact with our neighbors, our friends, because I think this is really important for us when we get the fresh air, listen to bird sounds, but also with our friends, and enjoy the social interaction with each other, which is really good for our mental health and their mental health as well. So let us work together with everyone, to build a greener and healthier neighborhood.
That's awesome. Thanks so much, guys. We're out of time, but I really enjoyed that, and thank you so much.
Thank you very much, Molly.
Thanks for joining us.
Bye.
Thank you everyone for attending.
See you, Emily.
Bye.
Bye.